to, or if I anticipated that I was going to have a lot of moisture, I might have put a chucks under there, a blue pad underneath so that it would catch anything if I'm going to dribble. But I'm going to be good and not dribble. But I would standardly put one under there anyway, just to make sure. So then I've got to remove the tape. How many of you have had tape removed and it's not been done delicately? Anybody have sensitive skin to adhesive? Hello, me. I could just like blossom. So you have to be very careful when you do it. This is nice silk tape. Silk tape is great. Paper tape is good. The old-fashioned adhesive is hard. You can do this a number of ways. Now, the reason I'm holding my hand, the underneath tape is actually holding his wound on. Okay, so we're going to pretend his wound doesn't exist. So all you have to do is easily peel back the tape. If you want to, you can fold the ends back. You don't necessarily have to do that. Again, loosening all the edges. See, this one's so short that I might have a little challenge, and that's life. Okay. Folding it back. Trying not to cause harm. And again, if a patient has allergies or if a patient has a lot of hair and this has been taped to hair, that's not going to feel good. So, you know, be gentle about it, just like with your kids with a Band-Aid. Sometimes it's easier to kind of take it off quickly. Use your own judgment. So I'm going to remove first this dirty dressing. I see his suture line there. I'm going to first, while I'm in here, looking at the wound exudate, okay? You know that term, exudate? All right, and I'm going to look at it to see how much I have on here, all right? I'm going to look at, and we talk about exudate because I'm going to have to chart what I've seen, right? I've got a chart, so I have to know.
What does that mean again?
Exudate is discharge, kind of
Okay.
think of it as anything that's come out. All right, I'll go right,
Okay.
right. And we have to talk in a familiar language. So usually when you're describing it, you do something that you understand. Because if I said a little exudate, a lot exudate, a little means different for you, little might mean different for you. So we talk in, I usually use money. Nickel size, dime size, quarter size. Everybody knows what size a nickel, a dime, and a quarter is. So that can give you a generalized sense. So I'm going to look at this, and I'm going to determine in there. And the brown is dried blood or dried sanguinous. And the bright red could be sanguinous as well, or could be a little serum on there, all right? So I'm going to, do you guys know serous sanguinous, serosanguinous, and purulent?
You just learned that.
You just learned that? Okay. So let me go ahead and write that on the board. I'm going to kind of do this real quick. We'll go up to the board. This is the vocabulary you need to know.